So I'm gonna talk about what happened in my accident. Yeah, we'll call it an accident. It was an accident. I didn't mean to jump off a truck and splat into the ground. And that's an accident. Talk about what happened. Show you my new spot real quick. Everything I got to lay out the new workout spot, which I'm not going to be able to even do a push-up for like another month or two. So I was inside a box truck, 18 feet or 18 foot, and I was just carrying Rubbermaid bins from the front of the truck to the back of the truck to put on the tailgate so that my stepdad could grab those and move them to the new garage. Just unpacking the truck that I was loading. And basically what happened is I made a row. So these are large Rubbermaid tubs, and they were stacked too high, so I don't know about that high. I got some more room, I'll show you. And it was a row of 5 and then another row of 5, and I was just pushing up the last one. My stepdad took one to fill the spot, and what happened, I now know, I didn't really get it because it was like I just jumped off the truck and landed on my side. So the tailgate is way down there. It had a lift that would come out and you could just walk right on, and that's what I was sliding the boxes onto, or the tubs or bins, whatever you want to call them. And the lift is black. Inside the truck is wood, and the bumper on the back of the truck, way down there, is black. So when I'm standing up, I'm 6'4", looking down at the tailgate or the lift, which is black, and I see the extension out on that side and out on this side, and it looks like the lift just comes in and goes around, and that all lifts. Well, this part is a bumper like 4 fucking feet down. It's not level. So I stepped on that area and just went down, and with my right leg, which was still up on the truck, I pushed, and I took the 2 Rubbermaid tubs with me, and I landed on my ankle, my knee, my hip, my elbow, I'll show you that in a minute, and my hand, and a thing of the Rubbermaid tubs kind of right here in my ribs. So I broke 4 ribs. There's still a rib right here, but it all just kind of caves in. I don't know. It's shaped a little bit like a small half pipe. That's not good. So I landed on my side on the pavement of the driveway, and Rubbermaid tubs right in my ribs. And inside one of those tubs was a large Budweiser bottle. You know, you put change in and stuff like that. And that broke, and that's where all of this cuts and everything came from, because I couldn't feel it. I can't feel pain. Like if you just cut my arm, you cut me, and I don't feel it. Or if you put a piece of duct tape on my arm and just rip it off, or like waxing or whatever, I don't feel that, like painfully. I know you just did that, but I don't feel the pain from that stuff. The only thing I feel is like blunt force trauma, like shock pain. Like when I hit the ground, I was in shock, like blunt force trauma. I basically, um, when I was pushing the bins up, I'm leaned over, and so I said that's about 3 feet up, and then from the tailgate or the lift to the ground was about 5 feet, so I say like 8 feet. Um, I just jumped over and went splat. uh, so I made a video when I got home, and I was like, oh, one more stuff. I don't know what's happening. So I got 1, 2, 3, 4. Right there, those ribs are all snapped, and then it goes down and then back up. The Rubbermaid tub just crushed my ribs, and it punctured my lung. And none of that's really any big deal. I haven't felt any pain from all of this stuff. My body's broke. It doesn't work. The worst thing is a hip pointer injury. I guess that's what it's technically called. When I landed on my side, I hit my hip, and that just ruins your whole leg. I can't stand. It just collapses. Yesterday it felt like my hip was going up into my ribs, and like my leg was just collapsing. And later last night it was my knee, and today it's my knee again. So maybe tomorrow my ankle. Then I'll be all right. I don't know. So doing the ozone and everything is good for you and helps, reduce inflammation. Which, oh my God, I had a lot in my rib cage, and like my lats are just, oh, they're broken too. Everything's broke, and so basically the ozone has helped feeling better, although I'm not in pain. Like you can tell how I'm kind of grunting and moving, and it takes a lot out of me, My bedroom's right there, and my game room or whatever, where I watch TV and stuff, is right there. So it's like 20 feet later after I talk. You'll see how bad my walking is. We're gonna go for a ride. So basically that's what happened is I stepped onto what I thought was part of the lift of the back of the truck, and it was actually the bumper, but they're both black, and because of my vision I thought it was all like one piece, and it was not. So I stepped off of the truck, and if I'd just frozen, didn't do anything, I would have hit my growing and just keeled over, and maybe that would have been better. I don't know, but my right leg pushed. I took the bins and just landed on them, and my hip, broke 4 ribs, punctured a lung, and the hip pointer injury, and then just these gashes. I've been doing kind of an experiment, like I'll do it here in a minute, putting my hand in ozone water, or ozonated water, I guess, and the wound on my hand, which is more like 2 gashes, and the area is only about the size of a nickel, and like kung fu chop, grab that part of your palm, and where your thumbprint is, that's where the wound is, and the top one was a big piece of glass that I actually pulled out of my hand, and the bottom one's a littler gash, and so it's like a deeper and bigger one on top, and a smaller and shallower one on bottom, and they make like a circle. It's weird. So I've been just putting that in the ozone water, and that's healing really nicely. Uh, it's not healing nicely. I mean, I'm like, my hand is gashed apart right there a little bit, but it looks a hell of a lot better than my elbow, where it just looks like I just scraped it all along the ground, and it's like a huge scab. It feels almost like I could just grab it and peel the whole thing off. I'm not gonna do that. Fuck. Bubble, bubble, bubble. Ugh. Pepsi, the elixir of life. Syrupy deliciousness. Yeah, my diet and everything else is. It's not good. It's not bad. It's like just normal people. But I drink like 3 to 4 Pepsis a day and have a bunch of junk food. Oh. So what I'm gonna do while I talk about MS, virus, Epstein-Barr virus, vaccines, mRNA, and probably do a bunch of rambling. I don't know. On my lap, I got a towel, just keep me dry, and then I've got a Rubbermaid tub. It's about 8 inches wide and 12 inches, 13 inches deep, or wide, long. Big enough for a size 13 foot to fit in. And it's like half full of water. Ugh. And then I have my tube coming from my ozone generator with the air stone on it. And it's just bubbling ozone through the water. Same as if you're making a glass of ozonated water to drink. And then I just rest my hand where the wound is on top of the air stone and just leave it here. And I do that for 10-15 minutes. I've been doing it 2 or 3 times a day for the last couple days. And I think it's helping my hand heal a lot better and faster than this. But maybe all this scabbing on my elbow will kind of fall off in the bed and I'll wake up tomorrow and it's magically healed. I don't know. I thought that doing this in the ozone water could mostly heal it in 2 or 3 days. Probably 2. You know, just overstating everything. I posted on Facebook that it was going to take 2 days and I'll just blow everybody's mind. I think I was on morphine. They gave me a lot of morphine. I don't know exactly why. I wasn't in pain. I don't know. But, so that's pretty much what happened with the accident. Is I basically just jumped off the truck 8 feet in the air, turned myself sideways, and splat into the driveway in a cement. But I'll just hold my hand here on this air stone. Whew. I left this water out overnight so that I don't have to carry it across, spill it, and it's like room temperature, but it's cold. That's why I said, whew. So I posted a video, it's a race, and I was, doing the ozone with my hand and nothing on my arm, and just seeing what healed faster and better and how things were different. I wouldn't want a scab like this on my hand. That would be horrible because it would just constantly break. It's right in the part of my hand where your pinky makes the bottom of your palm kind of curl in when you make a fist. And it just would break. It's done that now, especially with this holding it in the water and keeping it really moist all the time. That I think is kind of hurt the time as to like how fast it's gonna seal up and heal finally, fully. So the only way that ozone's bad, dangerous, annoying, in this case annoying, is breathing ozone. It can irritate your lung tissue, and that's what's happening here. Basically just the ozone that is coming out of this, going into the water, not all of it just stays in water, so it's coming out in the air, kind of evaporating. I'm breathing it a little bit. Not bad or anything, just makes the air a little bit thick, I guess. I don't know how to say it. Ozone, like, if I was to seal off this room and just do ozone in here for like hours and hours, only thing in here would be ozone. There'd be no oxygen. We need to breathe the oxygen. If we put the oxygen or the ozone in our body, then our body can use it as oxygen, as if we're breathing, I believe. Don't try that. It's just something I think. So, sitting here, the ozone in my face is just kind of building up a little bit every once in a while. I might wave it off or blow it out. Really no big deal. Trying to move, my hip is like broken. I don't It's been this is the 10th day since I launched off the truck. I had to go to the emergency room later that night, and the ambulance came and got me, and I was wheeled out in the gurney. Thing is awesome. Those are the most amazing pieces of engineering I've ever seen. You ever have an ambulance come to your house and there's like 9 flights of stairs and turns and all kinds of... Those things are like a video game. They're like the wheels just... and you just stay flat and you go down. And that stuff's pretty cool. So I went to the hospital and had x-rays and they gave me morphine and all that crap. And they told me I got 4 broken ribs, and basically I spent Friday night, Saturday night, and until 1 or 2 in the afternoon on Sunday in the hospital. And they really, I think this is the first time I've broken any bones. And I think that might be the longest I've stayed at a hospital. I came up with a new saying to describe myself. I'm a superhuman, blind, not smart person. You can insert whatever word you want there. But superhuman because I don't feel the pain. Blind, not smart person because I couldn't tell that that's not connected and it's all one level. It's the bumper way down there. That's not very smart. Should have just checked it real quick. Just tap it with your foot. There's nothing there. Don't step on it. But I just, sometimes trust and move and go. Whoops. Don't be a little bitch. Do it. So that's what caused the accident, is I stepped off the truck, quite literally. And, whoops. But yeah, I think that was the longest stay in the hospital I've had. Like 2.5 days or so. I can't remember how long I was inpatient when I first went blind in 2004. They gave me steroids and stuff. Was that 2 nights or just overnight? I don't know. But I've never broken any bones before, so that's interesting. Um, I just watched one of my videos from 7 years ago. It was my 1 year MS and ozone update, I think is what it was called. And a lot of things I said in that video um, pretty much came true. Were pretty close to spot on, or I don't know how to exactly describe it, but I'm not wrong on a lot of things that have to do with this stuff. Okay, I don't know how to say it. The information about the EBV, the Epstein-Barr virus, and the reason to me why that's significant is because they used U.S. service members' medical records, over 10 million data sets. So they were able to follow, airmen, Marines, sailors, Army through the years, because every 2 years, our armed forces, everybody has to get their blood drawn, and I guess, and so they had all that info to go through. And in that video that I just told you, I watched my 1 year MS and ozone update. I was like, if I had a lab or I had a research team or something, I could probably figure out. Guess what? Somebody with a fucking research team got the data, and they studied it, and they say people who have Epstein-Barr virus also have multiple sclerosis. So I was thinking back back in the day, like if I had a lab, I could just test everybody's blood for every virus that we know of in the world and find some common links and all this different stuff. And bitch, it's a virus. Probably more than a virus. Could be multiple viruses. Could be other conditions and a virus. Could be genetics and other stuff and a virus. And I don't know. Probably right there too. With LHON, or LHON plus, I guess I have now. Well, I've had for a long time. LHON and MS, there's a connection or correlation. I'm not exactly positive on that stuff. It's more something I learned and heard and moved on with all the crap I've had. The Dr. Hardings is the one who discovered the link in France in the 70s or 80s. I'm not really that sure about this info, so not hard to find. Type in Dr. Hardings MS LHON. I believe that search will find you right to it. But so I may have a virus, Epstein-Barr virus, which I'm going to get tested for and find out if it's something I have. And if I do, cool. That just shows that this research and me kind of going together. But the predetermined genetic condition plus a virus equals MS? Maybe? That might be a category that I fit into. And we just don't know. I think all of this can be not simply, we'll just say simply explained. It's not the actual explanation or the definition of everything and the real reasons and all that. This is just my thoughts. It's like the pandemic started and SARS-CoV-2, the COVID-19, when that, like the first 6 to 8 months, friends were asking, like, well, when are we going to know this? How long is it going to know that? Different questions about like timelines and info and when we're going to get it. I was like, the main answer was time. You just have to wait. It takes time to get people enrolled in some research study. It takes time to hire the data scientists, the doctors, the money, the funding. Who the hell knows? All that stuff's somebody else's boat. It takes time. So within time, everything's found out. It's not transferred this way, it's transferred that way, it's airborne, cytokine storms in the lungs, and then it affects liver, and there's been a lot that's been found out, and everybody's mad because it keeps changing. It keeps changing because the virus keeps changing. And so are the symptoms. Like in the beginning with the alpha, the original one, SARS-CoV. Yeah, that was mostly with the breathing and the lungs, and everybody was going to the hospital and they're getting on breathing treatments and stuff, and there was a lot of problems with lungs. And then, the Delta, the UK, and different variants, and then everything changed a little bit as we went through this process, and the virus mutated a little, and we got different variants, and they came from different regions, and every time one of these happens, we need time. So, basically, that similar to where I think we are now with MS and Epstein-Barr. And is it specifically just Epstein-Barr virus that causes MS in some people? Maybe. But why some people and not all people? Because I've also heard, I haven't really done all that much research on this stuff yet. I mean, I don't have a computer, no desk. There's a lot to be set up. I haven't done anything. My stuff's still all in a Rubbermaid tub. So, with time, we'll probably know all that stuff. And be more exact on what contributing factors kind of go into the ozone buildup in face. Contributing factors go into MS, like whether it's 3 viruses together equal that, and quick research is just something I hear in the papers that I post on the description of my one video, and like 90 or 95% of Americans already have Epstein-Barr virus. So it, in my mind, is probable that there's multiple things that go into multiple sclerosis. Because if it was just the Epstein-Barr virus, we would have a lot, like 200 million more, a lot, people with MS just in America. And so I don't think that's the exact case. Is it Epstein-Barr virus in combination with another, we don't know yet because time. They found this, so I assume over the next 3 to 5 years, the research and studies and tests and everything is just going to be more and more and more, and we'll find out more information. Maybe it's 2 viruses plus Epstein-Barr virus equal MS, and if you have a predetermined genetic disposition to develop MS, like I might with LHON plus, or Harding syndrome. That equals MS? I don't know. Time. We need time. Which sucks. Because MS isn't fun. Yeah. So basically the gig is up. It's not, I don't see, like in my one video, it was 7 years ago, 1 year MS and ozone update, I think is what it's called. I basically say stuff about, you know, the time it takes and how we don't know everything about everything, and just with more people and studying and everything like that, more info will be known. But I feel like that has taken one big giant leap forward with this information about the Epstein-Barr virus being a very high likelihood involvement in MS. Whether that's the only thing that causes it, which I don't think, because we have a lot more MS in my mind. There's 350 million people in America, and not that many millions of cases of MS. Although it's pretty prevalent, you know, it's out there. A lot of people have it. It's not like 100 million people have it. In America, that'd be a lot. It'd be like way more than a lot. So, is there other viruses? Is there predetermined genetic stuff? We'll find out with time. But because of this study with so many medical records over, I don't know what the time period was, 18 or 20 years, from the early 90s to the mid, I don't know, like 2015, like 95 to 2015, say, who knows, you have to look that up on the paperwork, or in the story, they say it, I believe. So much data over so much time gives me a good feeling they're on the right path. And it makes me proud in a certain way. Ha ha ha. Told you so. Doctor. I'm tired of being dismissed and just written off like I'm some crazy kook. I don't know what the hell they're talking about by every doctor for MS I've seen. No discussion, no back and forth, just, it's autoimmune disease. Okay, well, I'm not arguing about that. I'm trying to discuss what else might be wrong with my body. Doctor? And it just goes bad every time. The last one basically said that if I believe that, it's not going to work well for me. What? Okay, whatever. Bubbling ozone. Just sitting over ozone bubbling like this can make your eyes water too. So every once in a while it's like, whoa. But other than that, you're fine. So the MS might be caused by the Epstein-Barr virus. And with time, we'll know more. Why does everybody with MS have different symptoms? Well, hold on. Why does everybody with COVID have different symptoms from day one? That's what I've been saying to everybody in my life. Like, it's a virus. I'm telling you. My symptoms are different than your symptoms. My legs don't work. Your legs, you run miles and miles. It's a virus. It made sense to me for like a decade now. It's really irritating. really the only real reason it's been irritating in that fact is like the doctors. There's no like scientific discussion, I guess. I'm not a scientist, but yeah, can we talk about what's wrong? No, it's autoimmune disease and next patient. It's like a, I don't know, is there something about me? Leave a comment. Am I really annoying? Ooh, this is one. I have one of my, he was a neurologist or MS doctor, whatever. He wouldn't examine me. You know, we're supposed to like squeeze and, you know, lift our leg up and pull our toes up and push down and, you know, different things. Can you make a fist, squeeze my finger, blah, blah, blah. So it would do none of that. It would just sit on the other side of the room and look at his computer and type. That's not that helpful. So I'm trying to tell him about my ozone and, you know, just to talk. I'm like, you're a dumb doctor and it's just a virus. Oh, really? Then what virus? Well, I don't know. It was nothing like that. I asked him, I said, don't you want to examine me? No, next patient. I think what freaked him out is like, I'm gonna spill water everywhere. One day I was like, ozone makes me feel like Superman, and, you know, kind of flexed on him a little bit. And I'm not a scary person. I don't think that's what turned him off. I don't know. So, doctors from everything, like, flat refusing to examine me in any kind of way. Like, don't touch me. There's never any kind of discussion or anything. That's why I sit here and talk to myself. I'm just kidding. So that's pretty much the gist of it is time, which sucks. But there is an extraordinary amount of like bum rushing towards virus in a we'll stop you and kill you kind of way. This really excites me. mRNA and messenger RNA has some cool stuff. RNA is like the DNA of a virus, and being able to use that to deliver messages. And so the COVID vaccine from Pfizer and Moderna are mRNA vaccines, and basically scientists might probably describe it differently to you. But it's just kind of my simpleton way of thinking about it and describing it, explaining it, I guess. The mRNA is like the magic school bus. You ever seen the children's cartoon? It's like little cartoon kids, they all get in the school bus, and then it goes and miniaturizes and goes into the bloodstream, and they travel around the different organs, and you know, it's like school kind of little field trips to the liver, and they teach you about that, and then you go back through the colon and whatever. So it's a fun cartoon, but the way I describe the mRNA is that the COVID or Pfizer or Moderna vaccines, and I think they work probably a little bit differently between the two, and this isn't like an exact scientific explanation, okay? So the mRNA is like a magic school bus, and the virus is also in the blood, and it's, you know, attacking the cells and multiplying and everything else. So we put the message in the mRNA, the different proteins and stuff, to induce your body to produce the antibodies needed. Turn that away from me a little bit. Antibodies to kill the virus. And so the way I kind of explained it is, the magic school bus is cruising through your bloodstream, and some kids are on there having fun, and they're ready to learn about whatever organ or tissue sample they're going to go sample. This is starting to choke me up a little bit. There you go. So basically, on the school bus, there's a bunch of kids, and they're all having fun. And then there is the messenger RNA, the mRNA, and that has the code of the virus. And that virus is a bad virus. He's a bad kid. He's like shooting spitballs everywhere. He pulled on one girl's ponytail, cut another one's off. Yeah, he's just a bad kid, man. Bus driver's like, you know what? We're here. Bus pulls up to the gut. He grabs that little bastard by his neck, throws him out on the ground, walks out. Immune system. And all these soldiers come up. And he's like, you see this motherfucker? You kill this son of a bitch, and you kill him again. All of them. Every time. Kill him. And then he just gets back on the bus and drives away. And then the immune system just stomps the shit out of that mRNA, learns the code, and it through your whole body in seconds, minutes, whatever it is. Your whole body transfers, and everybody, all the immune cells, soldiers, have the code. And if they see that virus, they're going to murder the shit out of them. So that's mRNA, in my mind. It's the code. The magic school bus driver drops off the bad kid, the mRNA, and then takes the other kids on this magical journey of learning about the body. And the immune system learns who he is, passes him to everybody, and they stomp the shit out of him, and they learn it, and basically now you're immune to that virus. That's the vaccines that we've been getting. So, in my mind, while walking around with a super soldier immune system for that one thing. So mRNA, I think, is going to change a lot in the game of disease, and especially in something called autoimmune diseases. I don't study all diseases, and I know everything about all that stuff, and a lot of things that we say are autoimmune diseases, or we give the reason it happens, I think over time, the next 10, 20 years, a lot is going to be different. And this is one aspect of it that I think a certain way, but I don't know. Like with COVID and the vaccines, if you get COVID and you go to the hospital, you're on the breathing and everything, and you're not doing good, they did not, I don't know if they are now, but when it was all happening in the beginning, they didn't give you the vaccine because you already had the virus. To me, that doesn't make sense. And it didn't, over the last, it's almost been 2.5 years now. Shit. Damn pandemic. So it didn't make sense that, why wouldn't you give it to everybody? It's mRNA. It's a magic school bus with the code to kill this guy. Your immune system picks him up, stomps the shit out of him. Everybody learns. Cool. So if you don't have the virus yet, your body's prepared. If they ever find that, they'll kill it, whatever. But if your body already has that, Like if you are in the hospital breathing and you already have COVID, um, in my mind, that same thing. Vaccine, mRNA, code, kill virus. Hey, look, I found some right away. I found another one. Found them. And then it would just kill all the virus. But I'm not in charge of stuff, so I don't know. Everybody who didn't want it and then wanted it and couldn't get it once they were in the hospital, sick with it, that didn't really mix with me. I didn't understand that. Why not give it to everybody? It doesn't matter what time. In my mind, the virus is inside you. Give your body some stuff that you can kill it with. In my mind, if the virus is not already, if you don't have it, it's not inside you, give your body some stuff that will kill it with. Turn this off. So that was one thing with the mRNA and the COVID, the pandemic, that I didn't get why they were saying and doing it that way. And I don't agree with that, because mRNA, code, kill virus. Okay? If I already have it, then the immune cells have the code, and then they would just go right to work. Right? Or let me put this tub down on the ground. It's probably been like 20 minutes. So, man, this whole place is filled up with ozone. Basically, I bring up the vaccine and people who currently have COVID and are in the hospital. They weren't getting the vaccine. That doesn't make sense to me. And I bring that up because Moderna already is in a phase 3 trial. I think they said in that paperwork or the articles that I put up on the last video. This title is "Multiple Sclerosis is Caused by a Virus," I think. I'm broken. Oh man. So, people like myself, or probably a lot of you who are watching this, already have multiple sclerosis. That's cool. So, the Moderna trial for a vaccine for the Epstein-Barr virus, I don't know. I haven't really. I'm moving. I just broke ribs, and I'm not really in research mode right now. But I don't know if they're going to just give it to everybody. Like, if you already have the Epstein-Barr virus, will you get the vaccine? In my mind, yes. Because that vaccine then will kill the Epstein-Barr virus. Or are they just going to give it to people who do not have the Epstein-Barr virus and follow them over a bit of time, maybe 2 or 5 years, and show that their vaccine stops people from getting Epstein-Barr virus. Then maybe, see, this is all just a guess. Then maybe they'll give it to people who already have the Epstein-Barr virus and study and follow that, see how that goes. Then everybody can get it. I don't know. Oh. So I'm very excited because in my mind, the mRNA and the code to teach your immune system and everything, what proteins to make, how to do this, whatever. I assume it'd be different for every one of them, but in general, the mRNA teaches your immune system how to whoop this guy's ass. Not everybody's ass, just this guy, you know, like the COVID vaccines only teaches how to whoop the original strain of COVID's ass, and not the Delta and all the Omicron, and there's a bunch of different variants now. But the vaccine we're all using is programmed only for the wild type, the original strain that came out of Wuhan, China. But they have a very good efficacy rate for the different variants, and I think everything's fine there. It's like the grandma or the grandpa of the family, you know. The grandkids still the same family. I don't know. So I am very hopeful that I'll be included with the mRNA Epstein-Barr virus vaccine, and not told, well, you already have multiple sclerosis and Epstein-Barr virus, so no, you can't have it. That doesn't make sense to me. So, basically, when timeline. I'm thinking maybe 5 years from now, if magically everything works out the way I want it to, everybody gets a vaccine, Epstein-Barr virus gets killed in all of your body, and there's no cells left of virus hidden under your big toe or in the back of your ear or whatever, some random place in a molar. Viruses are sneaky. That's one reason I like studying them so much. And virology and all the different things I was doing years ago. Actually, probably about the time of that last video, 7 years ago. So with the mRNA, it's pretty much every immune cell in your body has got the message. They know how to kill the virus. But is it going to work as like you take the vaccine, every single virus cell gets killed, and then you just flat don't have Epstein-Barr virus anymore? Or would it, beat the virus back so much that you don't have it, but it's still in there somewhere, it's hiding. There's a little bit somewhere. And possibility it might, spike up again and hey, MS is back. Then you go get a booster shot. Like with the COVID, we're getting booster shots and stuff to keep our immune system efficacy of the vaccine higher, and then the MS goes away. I don't know, with time. So not all that much is known exactly right now, except for Epstein-Barr virus it's highly likely that it's involved. Single cause? I don't think so. Maybe not. Who knows? Real specific there, right? Um, so I'm thinking 5 years, 3 to 5 years. Uh, someone like me already has MS, and I'll get tested for the EBV and find out if I'm carrying that currently or not, and see how that works out moving forward in the future. But it's really hopeful news. Really hopeful. Really, really good. Good stuff. Oh, too far away. If I had a leg that worked, there'd be nothing wrong with me. That hip pointer injury, it's no fucking joke. I am a cripple. This is the most defeating thing I've been through. I've gone blind. I got MS, internuclear ophthalmoplegia. It gives you crazy eyes. Let's see if you can track this. People who can see, look at my eyeballs. When I go to my left, both eyes follow to the left, and then my left eye snaps back to the middle. But when I look to the right, both eyes go to the right, and my right eye snaps back to the middle. Other than that, I actually think I got it pretty good for that condition. It's caused by a lesion to a neuron that's set like an inch behind your eyeballs that controls neurons move the muscles to make your eyes move back and forth. So I've seen, like, just look that up on YouTube. People got these really wandering, crazy eyes, and wow, I don't want that. So I would think that not letting any more damage to that specific spot of that specific neuron, how do I do that? That's going to make it so it doesn't get worse. And there's a lot going on in life right now. Don't know exactly what's going to be, happening moving forward, work and health and everything. Yeah, in that one video 7 years ago, I said I was going to try and get more of my vision back, and I had microcurrent and homeopathy and all kinds of things that I was, researching, and I had devices and plan kind of put together for the most part. I never did any of that. Just more life, had to move and blah blah blah. So, let's go take a look at my room. I gotta do like a stand up on one leg. My right leg is just absolutely worthless. Huh. Those are the Rubbermaid tubs that I fell on. There's two of them stacked up behind this one. And that's basically what I fell on my ribs. You'll see in a minute. I don't really have a place to work out. Oh, whoa. I'll just take a seat. See, fucking leg collapsed. My backyard is like 40 feet wide, and I don't know, about 60 feet deep, and might have to build some pull bar and dip stuff out there outside, which I'm not really that excited about because I'm always fucking cold. And it's always raining, like 5 minutes ago. So that's where I was. That's my hangout room, bathroom. So there's nowhere in here to put all my workout stuff. It's a 10 by 10 bedroom. That's why I was saying probably have to build some stuff outside. So all my shit for working out is down in the garage in my TV room, I guess you can call it that. There's not really much room, enough room to lay down and do push-ups. I don't know, I haven't tried yet, because I don't know if I could get up once I went down. But that's pretty much everything. So, bedroom, bathroom, TV room, new spot. It's a nice house. I like it here. All the neighbors are cool. I haven't really met anybody. I only went outside once since we moved in. So I'll talk to everybody soon.